name is Jim. I'm with Team 7, and today we're going to be reviewing tracheostomy care for our patient. First of all, before we do any type of procedure, we want to make sure that we do have a doctor's order and that it should be part of our care plan. This is something that procedure should be done every day, and we should be teaching the patient or the patient's family and caregiver how to do the tracheostomy on a daily basis. Some of the equipment we'll need is, first of all, if you suspect the patient has any type of respiratory infection, then you should put your protective equipment on, such as a mask. But today I'm not going to use that because so you can hear me and be more understandable, or a isolation gown to protect yourself from any secretions or drainage that's from the tracheostomy. The other supplies that we should be having in the home is a source of oxygen, whether that's the patient is on oxygen, must be an ambu bag, or sometimes if they're on a positive ventilation. Otherwise, we're going to have the trach supplies that we need. We have the tracheostomy cleaning kit here, hydrogen peroxide, normal saline, extra cotton tip applicator, drainage sponge, suction catheter, and the trach tie. So first thing we're going to do is make sure we wash our hands and don our gloves and introduce ourselves to the patient as far as what we're going to be doing and what to expect from our procedure. It should not cause any pain or discomfort to the patient while we're doing this. And again, we should be demonstrating this to the patients and the family, the technique in doing tracheostomy care. So first we're going to assess the patient also, make sure what type of tracheostomy they have. It's either a metal type trach or the plastic type. In this case, this is a Shiley, or they can have the Portatec. And sometimes it can just be a stoma. That is, they just have an opening there, and they generally put a tracheostomy during the nighttime when the patient's asleep, and during the daytime the stoma is open, and in that case we're just cleaning the stoma site with saline and make sure there's no buildup of mucus or phlegm. So why are we doing tracheostomy care to begin with? Well, the tracheostomy site itself is not a sealed system, it's open, so every time the patient's coughing, he's producing phlegm or mucus, and that builds up around the trach site, and of course that can always be a source of infection. So we have to make sure that that is clean, and sometimes if the patient has heavy mucus production, a lot of coughing, then this process might have to be done more than once a day. The second point that I want to make is when we see the patient in their home, this is not a sterile technique, rather it is a aseptic or clean technique. However, the reason is because the patient in the home has a disposable inner cannula. If the patient has a permanent inner cannula and we're cleaning that, then it's a sterile technique, because we need to make sure the sterility of the inner cannula when we're cleaning that. And as I said, the cleaning kit in the tracheostomy kit has all those necessary tools to clean the inner cannula. But at this point, most of our technique will be clean or aseptic. So we're going to be assessing the patients first of all. We're going to make sure that their breathing is nice and comfortable, no respiratory distress, and we're going to be listening to the breath sounds bilaterally, making sure that the patient is relatively clear. If there's a lot of coarse crackles and the patient needs suctioning, then we need to do that first. And so we have a suction catheter here, and again, we can just hook it up to the suction machine and suction the patient as we normally do. Okay, so, and again, a key point here is never place yourself in front of the patient, because anytime we're manipulating the trach or the inner cannula, that will induce a cough and that will produce a mucus plug that's going to be flying in your way, and you want to avoid that. Again, you can don on some protective equipment if you feel that there's a lot of secretions or heavy production of mucus. So first thing we're going to do is we're going to open our tracheostomy kit here, cleaning kit. And as you can see, there's two compartments. One has the smaller compartment with the sterile drape, and then the other side will have the sterile gloves and the rest of the cleaning kit. So we're going to take our drape here and create a sterile field for us to use. And as I said, we don't really need a sterile technique, but we need to keep this area nice and clean so we don't introduce any organism or bugs to the patient. Yeah, it's almost close. Okay, so we're going to drop everything in here, in our field there. Like so. On the larger compartment, we're going to be pouring our hydrogen peroxide, about 1/2 inch to 1 inch. And then we're going to follow that with normal saline, diluting it to half strength, about a 1/2 inch to 1 inch. And then on a smaller compartment, we're just going to pour saline. Okay, put that away. Now I'm going to go to my patient and I'm going to remove the drain sponge that's here. I'm going to remove that, dispose of that. Okay. Now I'm going to be changing my gloves at this point. Clean my hand. So now I'm going to be putting on my sterile gloves. Okay. So we got our sterile gloves on. So what I'm going to do now is I'm going to clean the tracheostomy site itself. If the tracheostomy is a new trach site, and I'm saying that if it's 10 days or less, we need to clean it with saline only. If it's an old trach site, and most of our patients will be, in fact, it'll be an old trach site because they've been in a nursing home, they've been recuperating. We can use the hydrogen peroxide, half-strength hydrogen peroxide, to clean the site. And how we do that is dip the cotton tip applicator, and we're going to clean top to bottom. Make sure that we're removing any secretions or phlegms. And while we're doing that, we're also going to be observing, making sure that there's no redness, tenderness, or any unusual odor that we see at the trach site itself. And also make sure that you clean the bottom part of the trach site, because that's usually not easily visible, and we'll make sure that that's very clean as well. After you clean it with the hydrogen peroxide, we now will rinse that with the normal saline, again dipping the cotton tip applicator and rinsing it off with the saline, same way we cleaned it. We want to make sure that the trach site itself is dry, and you can use the sponge that's provided for you and gently insert it inside there to make sure that we are cleaning it's drying, and including the bottom part of the flange of the tracheostomy. Make sure it's dry. Okay, so we've done that. So if you look back here, these are the brush that is used for actually cleaning or scrubbing the inner cannula. But these days we really don't do that anymore, since most of our patients will have disposable inner cannula, and as I said, we don't need to do that. And so this is the cleaner, and this is a pipe cleaner. You actually insert this inside the inner cannula to make sure that it's dry and not moist before you put it back into the patient. So we essentially really won't be using this at this point. At this point, we finished cleaning the tracheostomy site, so now it's time to change the tracheostomy tie. And usually it's done once a day, or if the trach tie is soiled or has moisture and what have you. The cleaning kit actually comes with this trach tie, and for those of us that's been around the block a few times, as you can see, this is actually a dental floss. So we've been securing our trach ties with the dental floss all these years. So we're not using this anymore. We disposed of that, and instead we now have our modern or more comfortable trach ties. As you can see, it's very it has foam and secured by Velcro, and it's much more comfortable for the patient. Okay, so we're going to be replacing the trach tie at this point. So first of all, I'm going to insert the trach tie behind the patient. Okay. Now we're going to be removing the existing trach tie. Now I'm not suggesting that you guys do this because, and kind of keep in mind that anytime you manipulate the trach or the inner cannula, that can cause the patient to cough. So we have to make sure that the tracheostomy is secured all the time. You can ask a family member to assist you in this process. And as I said, I don't encourage this with all you nurses, but in my case, my particular case, I was fortunate enough to be born with a third arm. So what I do is I secure the trach tie with my, or tracheostomy itself, with my third hand. As you can see, make sure that that thing is secure there. Now I can use my other two hands to slowly and gently remove the existing tracheostomy. Okay, remove it on both sides, like so. And we now remove this. Now we're going to put the new trach tie, and it's going to go right inside the eyelet here. And if I can demonstrate, I'm going to remove my middle finger out of the way. Okay, and insert this like so. Okay, like that. Let me demonstrate that again. For those of you who didn't see, lift up the middle finger here, get it out of the way, and I'm going to insert this trach tie and secure it with the Velcro like so. And then I'm going to do the same thing on the other side. Oops, there goes my head. Okay, what you want to do is you want to make sure that the trach tie is snug, not tight. So after you put it on, you must be able to put a finger or so inside there so that the patient is comfortable with that trach tie. Okay, so that now our tracheostomy is secured, it's not going to go anywhere. Okay, at this point, we're going to go ahead and put the trach sponge on. And as you can see, these are already pre-cut. Some people will actually take a regular 4x4 and cut it, but I don't like that because there's some sediments that can actually go into the tracheostomy. So what we have in the agency are these pre-cut drain sponge that the patient should have in their home. Okay. At this point, we're going to be replacing the tracheostomy sponge, and we're very easy to do. We're just going to insert it underneath, and slide it on top, like so. A little bit difficult with the mannequin, but we want to make sure that that sponge is nice and tight right there. There's no crinks or like so. Now the patient should have some extra supplies of drain sponge in their home, and because depending on the secretions that they produce, this might have to be changed several times during the day. So after we replace the tracheostomy sponge, we can now replace the inner cannula. And as I said earlier, these are all disposable, so it's a one-time use. And the inner cannula is sterile, so we need to keep a sterile field as far as when we're replacing that. And we have here our disposable inner cannula. And we just open that. And we're going to slowly remove the inner cannula from the trach, and it's clipped on there, so you just push on this and then pull it out slowly. And again, when I pull it out, I want to observe the inner cannula for any foul odor or any unusual coloration, or that could be an indication that there is a respiratory infection going on. So I will also dispose of this. And my inner cannula, I'm just going to make sure that I just hold the end of it. And again, there's a clip. So slowly, I'm also going to be looking at this, the tracheostomy itself. Make sure it's clean and there's no sediments or any kind of unusual mucus in there. And slowly just put it in there. And again, this just clips on to the tracheostomy itself. So we finished with the tracheostomy care, and at this point we just need to document as far as what we've done, the tracheostomy care, and if we were actually instructing the family or the patient how to do the procedure and how they did, and if in fact they are independent. If there is any type of unusual findings such as redness, tenderness, or color, we do need to notify the doctor and possibly CNS so we can treat that early. That concludes our demonstration with tracheostomy care. Again, my name is Jim. Thank you for watching this video. Until next time, bye-bye.